Do you know a kid who often loses his temper, who's touchy and easily annoyed, who is angry and resentful, argues more than you think he should, and is constantly shifting the blame away from himself? Well, if so, and that's been going on for longer than 6 months, that's pretty close to a diagnosis of oppositional defiant disorder. And those of you who've seen my previous videos know that I'm not a big fan of that diagnosis. And here's why. In an ADHD kid's brain, he or she is hearing these comments frequently. Why did you do that? Why didn't you do that? How many times have I told you? That's annoying. Please be quiet. Stop talking. Don't interrupt. If that is the steady stream of commentary that your brain is hearing, I don't think that that's oppositional defiant disorder. I think that those symptoms are oppositional defiant behavior that come from human nature. Anyone who's corrected on the job every 30 minutes by their supervisor, any adult is going to get passive aggressive with that supervisor. And I think it's unrealistic to have kids stay in a positive frame of mind when they're being criticized so much for the fact that they're not accomplishing what they need to accomplish, and they're being impulsive and their behaviors can be disruptive. I'm not a psychiatrist, and I didn't help write the big purple book they use as their manual. But I can tell you this, I see a lot of kids who come to my practice with exactly those problems. And when their ADHD is treated, very often, almost always, those problems are minimal. So before labeling a kid with another disorder, let's treat the ADHD if it's present and see how oppositional defiant behavior changes. And as professionals, let's do a little more digging into why oppositional defiant behavior may be occurring.